They are more concerned about being separated from their family members than they are about COVID.
BC's Seniors Advocate says many residents living in long-term care are in crisis, experiencing weight loss, worsening moods, depression.
We need to remember that some family members have been separated for almost 9 months, and we need to decide how long we continue these separations.
Mackenzie is recommending the province loosen restrictions by allowing more frequent and longer visits to happen in private rooms, and by allowing more than one designated visitor. A step that's welcomed by families where only one sibling has been able to visit regularly.
A lot of people, it takes time to catch up on what they've been going through and to talk to them and explain what you're doing. And it just takes time. And I know for my mom, she just always felt rushed, like, oh, you're leaving already. So longer time is definitely really good.
Currently, the majority of visits are only once a week or less. Half the visits in long-term care only last 30 minutes. But the recent jump in COVID cases has some worried about lifting restrictions. The Fraser Health Authority is cautiously optimistic.
I think there's an opportunity with the provincial investments of $160 million to hire more people to ease visitor restrictions and at the same time still protect our vulnerable population in that setting.
Mackenzie says the added risk of transmission can be managed by screening visitors for symptoms.
These people are already visiting. We know who they are. They've washed their hands. They're wearing a mask. They've undergone health screening. They've had their temperature checked prior to each visit.
Long-term care homes can already allow for longer visits. It would take approval from Provincial Health Officer Dr. Bonnie Henry to increase the number of visitors. Eva Yuguen-Senge, CBC News, Vancouver.